Okay, hello everyone. So today we have another patient here ready to fix their bunion, right?
Yes.
We have a really bad bunion. We have an overlapping toe here. This second toe is pretty much dislocated. This is one of the worst type of bunions you can have. Okay, it's very, very rigid, okay? And we're gonna have to do a lot of work here. So usually when we fix bunion surgery, traditionally we used to open up, make a really long incision here, open it up, clean up the bone, make the cut, bring it in. But today we're gonna be doing a bunion surgery, but it's gonna be minimum incision surgery. Minimum incision surgery means that we make small cuts. So if you see here, I already put a little marker on the areas where I'm gonna be making my cuts. I'm gonna have one here, one right here on the side, where I'm gonna use to shave the bone, and another incision right here. With pretty much 3 to 4 or 5 stab incisions, I'm gonna be able to bring this toe down and bring this bunion right over, okay? This toe is also very, very long, so we may shorten it a little bit. The other toes are okay, but really this overlapping toe is terrible because it's gonna cause maceration, which is wetness in between the toes, and obviously difficulty with wearing shoes and, shoes rubbing the bunion area, which we don't want. Because this is minimum incision, it's awesome because, again, the patient is gonna heal pretty fast. It only takes 2 weeks to about 3 weeks for those areas where I cut to heal, and the swelling is gonna be less, the pain is gonna be less, and generally we don't have to use any hardware. Okay, so it's a very natural way of healing, a natural way of correcting a really bad bunion, and the patients do very well. We allow the patients to walk right after the surgery, and the patient is only going to go through just local anesthesia, so which means no general, no putting a tube down your throat, no IV, no propofol. You're awake during the surgery, or you could take a little Valium and sleep through the procedure, but when you wake up, you're pretty much normal and you're ready to just walk right out. And you get to see your outcome of your surgery, and you get to talk to the doctor and tell me if I did a good job. All right, we're ready? Let's go. You definitely didn't disturb me at all. You were very relaxed, very calm. Excellent. Did you get a chance to see how straight your toe is? Yeah. You saw it yourself.
I saw that.
Right. Amazing, huh?
Mm-hmm.
All right.
I don't think it could be back. Well, no, seriously.
So we're going to be wearing this boot, and this is going to be your new best friend.
Yeah.
Okay, as long as you stay in the boot, pretty much my correction is well protected. This is like a walking cast. Okay. Any pain?
No.
Did you feel any pain during the surgery?
No pain at all.
What was the hardest part of the?
Like the first part was just
to put the needle, right? Yeah. But after that,
no
nothing at all, right? Excellent. Nothing. The surgery took about an hour and 15 minutes, which is pretty amazing. 3 weeks, 2-3 weeks, we take out the sutures. And we bandage a little bit more, but it doesn't stop you from walking, from shopping, from doing the things you want to do. Right. Okay, walking is allowed, okay? It's actually encouraged. Just don't go shopping all day long. So every week I will be seeing you until I change you from this boot to a regular surgical shoe, and then from a regular surgical shoe you will get into a tennis shoes. Yeah. Okay, bone heals 6 to 8 weeks. So by 6 weeks the bones are pretty solid where they need to be. They're not going to be able to move anymore. So I really don't tape after that. Okay, but I'm going to keep taping and taping until about that 6 weeks to 6 weeks, and then by 8 weeks you're fully you'll be ready for the next one. Yes. All right. Thank you so much. Good
Okay.
seeing you. All right.